Hi everyone, welcome to my channel. My name is Yana. I'm one of the registered nurses. Currently I work for Queensland Health in the general medicine ward in a public hospital, and I do live and practice in Queensland, Australia, for those of you who were wondering. And I do have a lot of nursing content for you guys in the nursing playlist, so I will try to link it in the description box below or in the end of this video. Feel free to go and check it out. I have a lot of different nursing topics since I was a student up until now, so I think it's very helpful, because when I used to be a student I was thriving to find any information about nursing jobs, studies, nursing experience, any hints on YouTube, and I was enjoying watching the other nurses. It was so inspirational and supportive to me, and this is what I'm trying to do on my channel as well. So if you have been following me for some time and haven't subscribed yet, please do, because it does help the YouTube algorithm to push my videos and recommend it to a wider audience. In today's video I want to talk about gaining experience in aged care, and if it's important or if it's not, if you want to go into a clinical field. This question has been asked at least 12 times from what I remember now under my different nursing videos in the comment section below, and I believed that the people who ask it the most are the people who are either about to graduate their diploma or degree in nursing, or they are already graduated and they're trying to apply for a clinical position in a hospital and they can't get it. So the reality is most of private and public hospitals require from nurses to have at least 1 year of experience elsewhere. They don't really specify where, whether it's a aged care, community services, disability services, or GP. They just want you to have 1 year of experience as a nurse at least, working autonomously, knowing safety rules, knowing how to administer medication and all of that, and only then to apply for a clinical position at the hospital. So people thinking that going into aged care is the easiest way to get your experience, and they were asking me if it's worth it in the end of the day. Okay, so yes, it is the easiest way. Aged care is the most easiest place to go to and get the job in, and the turnover of nurses in aged care field is very high. Why? Because it's not easy to work in aged care, especially if you work there on a regular basis as a permanent nurse. You will have a very heavy load and not many people can handle it. So they purely go there for 1 year of experience if they have a goal of going clinically. Okay, it's like when you are a teenager, you want to get your first experience going started. You know, you go to work in a shitty job like a McDonald's or Drive Rooster or whatever. You know it's a bad job, but you also know that you are there only temporarily to get your experience, and then your final goal is much better place of employment. So this is pretty much how aged cares are looked at by other people, and they will still interview you, okay, before getting a job, but they will take you easily. And also currently we have a high demand on nurses because we have massive shortages, and because the aged care sector is very heavy to work in, it has shortages there of nurses, even more than in hospitals or any other places of a nursing field. Okay, so they will just take you, they will literally kiss your hands to go and get your experience there. But look at it from the positive way, okay? Aged care may be very heavy to work in, very busy, but all of that will still give you very good skills to bring with you to your interview and to put it in your resume when applying for a hospital position. And I will tell you about the skills in this video, what you can bring with you by working in aged care during that one very heavy busy year when applying for a clinical position. Okay, so the first skill that you will gain is a time management, and this is very vital skill for you to have as a nurse, especially when you're working at the hospital, because I work at the hospital and I know what it's like. So I'm talking from my experience, time management is very important. When you will be working in aged care, you will be responsible for looking after a particular amount of residents. You will be also responsible for looking after your carers that will be working under you, and also your ENs. Every aged care has a different structures, but usually ENs, they would report to RNs, and then EN and RN would have a group of carers working with them in a particular wing of that aged care. So you will learn how to manage your time and your day. You will learn which tasks are more important and needed to be completed first as a priority, and which tasks can be done later. You will also learn that some tasks, they need to be done no matter what, like your medication rounds. You can't defer those. Medications have to be given in a particular time, and it has to be a window time in between the doses. So you should not be late with your medication round times. So you will learn how to plan your day. You will learn how and when to plan your dressing changes as well. Because remember, your shift in aged care is very busy. You have families calling you, talking about residents, waiting for updates. You have hospitals calling you if someone had a fall yesterday and had a transfer to a hospital to update you as well on that resident. You have your GPs coming on the rounds as well, and they will be asking you about pain management for a particular resident, antipsychotic medication management, because those two need to be reviewed on a regular basis. Making sure that the pain management is working, the dose is working, the type of medication, the frequency, antipsychotic as well, if the dose is not too high, if it's not too low, because we don't want to promote falls if someone is sedated too much. So there is a lot of aspects that the doctors need to look at when they prescribe medication, and you as a nurse, you see those residents all the time. You can see the effect of those medications on them, so you can report it back to the doctor, and this will help the doctor to make a decision in terms of changes in medications for that particular person. You will also have falls. People fall, it's aged care, they're all old, mobility is compromised, mobility is declining with age, plus dementia, dehydration, they don't want to drink or eat a lot. So when someone had a fall, there is a whole procedure that you need to do to maintain that situation, and in many cases send that resident to the hospital. This will take at least like 40 minutes out of your time. So it's pretty heavy. So when you start to familiarize yourself with the tasks that you need to do throughout your shift, you will start to learn how to manage and plan your shift in a better way. So you could either complete all your tasks or delegate it to the nurse at evening on an evening shift. Because remember, all nursing cares are 24/7. You're not a superhero, you can't complete everything, but you will learn which are the most important and mandatory ones that you need to complete throughout your shift, and you will start to manage your time correctly. The second thing is prioritizing. You will learn how to prioritize your tasks. You will learn that some of the tasks, they're very important and they need to be done first, and then the other ones can wait a little bit and you can do it later. Or, for example, if something happened, like someone had a fall and you are about to do your dressing changes, and here is the carer calling you and say, "Hey Yana, Mr. Smith had a fall." So you need to leave the dressings, you need to go to Mr. Smith and assess them and see what's going on there, how complex it is, does the person need to be sent to the hospital, or was it just a slight down to the floor fall from a chair, for example, nothing serious. It's still a lot of paperwork needs to be done even in that scenario, but at least you don't have to send them to the hospital. So that means that some portion of your time throughout the shift will be taken away to deal with that situation, right? Document it, do all the forms in the system, complete them, and all of that. And if you have dressings that need to be done on that day, you can prioritize by looking at some of the dressings and see, okay, I am not able to do all of them today. Let's say you have 10 of them due today. Like, it's impossible. Now I have these extra tasks that have appeared. So now my time is left much less for the dressings. So what I can do, I can prioritize the most complex dressings today that needed to be changed as a priority. For example, the leaky dressings, something that had infection, you know that it's infectious, so most likely you would want to change it today to give it a nice clean dressing, so you won't promote more infection happening there, even if the person is on a short course of antibiotic. So you will learn how to prioritize your tasks, which one to do first, which ones to do later, which are more important, which are less important, and can be delegated to a next shift nurse. The third skill and ability that you will gain as a nurse is the medication administration. Safety about meds that you give, and also your knowledge. You will learn what medication is for. And look, when you finish your nursing degree, graduate, and you go into working in an aged care sector as your first job, there is no way you will bring the knowledge of all medications in your head. I'll tell you that half of it you won't know. Okay, you won't know. But what nurses do who are new to the workforce right after graduation, we educate ourselves. Okay, you have the charts of the residents where you have the medication written, your medication order, you will have the signature of a doctor, date when it was written, and you will have a route of the medication, how to give it, and also indication. So you will have this chart with you all the time on a trolley that you will be pushing the medications on. I'll try to find for you a picture of a trolley that the nurses use in aged care to push the medication. It has lots of different drawers, and each drawer inside has a section of that particular resident, and it has all the medications in it. Most of the medications usually come in a roll, but it doesn't have an indication on it. It has a date, time, because the person might be having different medications 3 times a day. So it will have a sections for 3 times a day with the date of that day and then the times when to give. You will have the name of the medication and the dose. That's it. It won't have a indication on it. Okay? So you can find indication in a residence chart, medication chart. You can open and see the indication in there. And this is the easiest way to find it. If you don't have a chart with you, if the doctor took the chart, if they came during your medication round or whatever, you can just Google it. Just Google it and you will find what that medication is for. When I used to be a new employee as a registered nurse, and also back then as EN, I would research what medications is used for, the class of the medication, and the side effects. Side effects are very important because there are some medications for heart that can affect blood pressure. There are some medications as diuretics like your furosemide, which can affect the blood pressure as well. If someone has a swollen legs, edema for example, but struggle from low blood pressure, you need to be very cautious as well, and maybe check the blood pressure on a daily basis, making sure that you're not lowering the blood pressure of that person, because when the blood pressure is low, the person might feel dizzy, and that can promote falls, especially in elderly people. And if that person is on furosemide, most likely they will be on some sort of fluid restriction. So make sure at least that the person is getting enough of fluids within that fluid restriction. So even if you give that medication and the person still has a blood pressure low, which is normal for them, but that medication obviously will bring it lower as well, make sure that that person drinks, even within the limits, but at least drink. Okay, so you need to familiarize yourself how medication affects the body, and also interactions with other medications as well. For example, your digoxin as well, it can affect your heart rate. So if your resident sitting already with heart rate below 60, you may be cautious given that medication. So at least check daily as well the heart rate or prior of administration of that person. It's very, very hard in aged care to do a proper checks. Like when I work at the hospital, if I know that I'm giving antihypertensives, if I know that I give antidiuretics, if I know that I give something like digoxin, you know, I would be checking the OBS of my patient right prior of giving those medications. In aged care, it's just sometimes physically impossible to do the right things all the time. It's just very, very difficult, although at least you can check it once a shift to make sure that you are safe. Okay, so this is the skill that you will gain as a nurse in aged care in medication safety. And will be very vital skill for you as well to bring with you to the hospital, because you will be administering a lot of medications, and throughout the year of working in aged care you will learn a lot of medications. You will be doing the same medications pretty much every single day, so if you will research them once today, once tomorrow, you know, it will set in your brain and it will stay in your memory, and you will learn much more than when you were just in the beginning of the year. So you will feel more confident when you will be applying for a clinical position, because you will already have some sort of knowledge of medication, and you will be safe as well. You will learn the routes, you will learn how to deal with people who are elderly, what's the best way to give the tablets, whether you need to crush it, break it, or mix it with the custard, for example, to a better swallow, things like that. The fourth skill is communication, and this is very important as well. By working 1 year in a nursing home, you will learn how to communicate with residents, with your colleagues, with doctors, which is very, very important, your physios, dietitians, speech pathologists, and your management as well. You will have that confidence of talking to your management in a more like relaxed way. You're not going to be scared from them, you're not going to be scared talking to the doctors as well, because you as a nurse in aged care, you will need to communicate with doctors about the things that I mentioned earlier as well. You will need to adhere to the changes that the doctors come and do. You will need to listen to them, you know, suggest things as well. For example, if you've noticed that someone is showing signs of infection like UTI or infected wound, you will need to advocate for your resident to the doctor. You will need to express your concerns from your understanding, from your scope of practice, and then the doctor will have a look at it and both of you will make a decision. So it's a teamwork in the end of the day. And I understand that for a lot of nurses who just have graduated, it's a fear to talk to doctors, it's a fear to express your concerns, your suggestions. Oh my god, I think giving suggestions was the hardest one, because you feel so like unexperienced and not confident at all when you talk to doctors in the beginning. But then the more you do it, the more braver you become and the more confident you become, and you would be actually doing it as your second nature. It will be like part of you. Yeah, I'm advocating today for my resident, you know, this and this happened, we have a problem here, how can we fix it, you know, and you can bring your suggestions to the tables as well. When you will be moved to the hospital, you will be communicating to all multidisciplinary team members every single shift. That will be just part of your routine all the time. So this is very important, guys, as a skill to bring with you. The fifth skill is delegating cares. As I mentioned before, you as a nurse will have a team of carers working with you on a shift. If you are an enrolled nurse, you will have your team of carers working with you. If anything happened out of your scope of practice, you will need to delegate it to your registered nurse, and then registered nurse, she makes a decision or he makes a decision, and both of you do it together. Okay, in my aged care we have a little bit different system. I'm working by myself on the whole floor of 36 residents. We don't have as many ENs. We used to have a couple of ENs before, but then I think it was 2 ENs. They have moved to the hospital, and since then they did not hire ENs. They prefer more RNs. We do have, I think, as well 2 at night shifts now only. So I as a RN look after one floor, which is 36 residents that are my residents, and I do have 4 carers working with me on that floor. So when I talk about delegation of cares, for example, one of the carer will come to you and say, hi, Mrs. Smith, she's been looking a bit confused today and she's not herself. She is forgetful. She goes into places that she doesn't usually go. She does things differently. She doesn't follow directions. You know, she's confused today. And this could be indication of UTI. Very easy, because UTI symptom is a confusion. Or she might be dehydrated and that's why she's confused. So you as a nurse, you will use your nursing judgment. Again, from the knowledge that you have gained at uni, you will ask the carers, hey, can you please monitor if Mrs. Smith is actually drinking enough of water today? Just put her on a fluid balance chart to monitor how much is actually going in. Can you please monitor her urine output as well, the color, the smell, and can we please do a UA dipstick? And if you find that nitrates or leukocytes are plus highlighting, please preserve some urine, and we're gonna send it down to pathology. Not down, but we will send it in my HK, we're sending it down and then pathology picks it up. You as a nurse, you won't be able to do all these tasks by yourself. You won't be able to monitor Mrs. Smith, her oral intake. You won't be able to be there to collect the urine sample. That's not your tasks to do. You have medication administration, you have communication with doctors, dressings. It's too much on you as a nurse already. So here it comes in place your delegation. You will ask your carers to collect the UA, and usually they already know what to look at when they do the dipstick, indicating that it could be UTI, and then we can send it. Even sometimes, if onset of confusion is very rapid, very acute, something that never happened to that person, I would even refer it to the doctor to do bloods as well to see if there is any signs of infection there. It could be, source could be not just UTI, it could be anything else. But it's always good to do a UA as well. So you will delegate those cares to your carers. If someone, for example, had a fall yesterday and have maybe pain in a bruise inside, not nail fractures been found, maybe the person went to the hospital, came back, done the imaging, nail fractures, all safe, but they still have a pain from the fall because they hit their knee, hit the elbow, whatever, there is a bruise. You as a nurse won't be able to stay with that patient all the time to monitor the pain levels. So you can ask your carers, when they do the cares for that patient, when they bring the food for that patient, when they see that patient moving from toilet to the bed, vice versa, see if that person is in pain, and if they see that the person is in pain, come and tell you as a nurse, and you will go and give the pain relief. You know, again, so it's delegating cares, and you can ask that throughout the handover. You can ask to weigh someone, because you as a nurse not gonna do that weighing. We usually do the weights once a month, every month, of all the residents in our facility. And when you start working in hospital, we do have a mix of ENs and RNs, and we also have ANs. And delegation is very important, because you will have patients who are on feeds. There is no way you will have time to stand for half an hour and feed someone, because the breakfast come at 7:30, and this is the time when you do your medication round, and you have IVs, injections, you have orals. It's heaps of medication that you need to give to your patients. There is no way you can spare half an hour standing and feeding someone. So this is where you have to ask for help by delegating this care to an AAN or to your float, and they will come and do that task for you. And if you have someone to need to go to toilet as well, you can ask your float, you can ask AAN, and delegate that task to them. This way you will promote work as a teamwork, and when we work as a team, we complete tasks faster. We actually complete most of them throughout our shift because we work as a team. But team doesn't happen, working as a team doesn't happen without delegation. It has to be, we need to all know how to delegate the tasks. We need to know how to ask for help as well. So this is something that you will carry out from your experience as a registered nurse. And the last one that I have to mention here in this video that I think it's important as well is ability to follow policies and procedures. When you work as a nurse, whether you are in a aged care field or in a clinical field, there will be hundreds of times when you will come across unfamiliar treatments that you will need to perform, assessments as well, or even medication, anything. Just make sure when you come across something unfamiliar to research it through policies and procedures of that particular place that you work for. Do not do things that you are not sure about, forgotten some parts of it, the order of it, or whatever. Like, for example, you need to change an IDC in aged care. We do have IDCs that are permanent. They need to be changed every 6 weeks, okay? You as a nurse will be changing the IDC. You are now starting as a registered nurse. The last time you've changed IDC was with your body nurse on one of your placements, and you've never done it by yourself without anyone being with you there. Okay, now you have to change this IDC. And you've forgotten the whole procedure, or you've forgotten some steps of the procedure, you know, don't do it. Don't do it if you're not sure. Don't do it if you've forgotten some parts of it. Just find the most experienced nurse in that aged care, arrange a time when she can come or he can come to your floor, and you can do it together. If the nurses are busy, we always have clinical nurses, your CNs, who can come and help you to put the ADC. But do not do it by yourself if you're not sure, because remember, by the end of the day, it's your safety of your registration, and it's the safety of your patient or your resident as well. And I think the ability to stay safe, the ability to understand that it's better to research, it's better to adhere to a policy, or to ask someone who is more experienced, is very important for you as a safe practitioner. And when you go to the hospital, you will come across a lot of different procedures that you may not know about or forgotten from your studies at uni, and you will need to follow the policies and procedures of that hospital. Like, for example, when we give IV infusion of iron, we always have a printout of a policy and procedure, how to give it and how to monitor it throughout the position and after, given together with the infusion. Always, it's like the whole box comes to us, whether you know it, whether you don't know it, it's always there. And it's so helpful, because I've used it multiple times when I was in the beginning of my grad year, and I didn't know yet. Now I can do it with my closed eyes because I've practiced it already so many times. But it was very important for me back then in the beginning to adhere to it, so I could do things correctly and keep my patients safe. So those are the 6 skills that you will bring with you to the interview, and to put it into your resume when you will be applying for clinical positions. So when you're looking at aged care, look at the positive side of it. Yes, it's a very heavy environment to work in, but it will give you heaps of very useful skills that you will need to use in your resume and on an interview when you will be looking for applying for a clinical position. And they will be vital skills to use on a ward, and I'm just telling you this from my experience as a registered nurse. And if you have more skills to share about, if you've been through your year of experience in aged care and you want to share with the rest of us on my channel, please feel free to do that in the comment section below. If you do have more questions about working in aged care, please leave your questions down as well. I do believe I have a video talking about tasks that nurses perform in aged care as well. I'll try to leave the link for you guys down below as well. Go and check that video out. I talk about all the tasks that you will be doing as a nurse in aged care, so you can familiarize yourself more about how the routine going in there and what nurses do in aged care. So check that video out, and thank you for watching, and I'll see you in my next videos. Bye.